Compounding also has a place in veterinary practice, where medicines may be altered to suit drug absorption, metabolism, and swallowing abilities of different species. Simple compounding, involving the use of an established formula, is a required competency for all pharmacists in Australia as part of their undergraduate degree. Complex compounding, on the other hand, which calls for specialised facilities and equipment and may contain restricted drugs, requires further postgraduate training. The use of small-scale compounded medications carries certain risks, as they are not assessed for product quality, stability, or efficacy. Ingredients may degrade when exposed to water, oxygen, or heat, and may interact with excipients or preservatives used in the manufacturing process. Patients may be at risk of compounding errors, such as the incorrect strength of an active pharmaceutical ingredient. And there is also risk of contamination by microorganisms, which has resulted in cases of infection such as meningitis that can cause permanent injury or death. In the past, pharmacists and doctors have worked together to create individual therapy plans and medication for patients. With the commercialisation of the pharmacy industry, the role of the pharmacist has largely changed from compounding individual medications for each patient to dispensing standardised products. However, the presence of pharmacists within the collaborative healthcare team has been shown to improve patient outcomes and provide better health management through patient education and monitoring. The importance of a collaborative team-based approach to patient care and safety has been well established within the health field. Recognition and understanding of the roles of other professions encourages practitioners within the healthcare team to provide better, more holistic care to patients. And interprofessional learning at a pre-registration level has been demonstrated to improve understanding and respect of other health disciplines and the importance of teamwork and communication to ensure patient safety. Rural and remote communities are an ideal context for undergraduate students and health professionals to participate in IPL, generally being home to small multidisciplinary teams which provide a wide range of health services to deliver the highest possible standard of care. These teams often include both resident and visiting health professionals and may rely on communication technology. The requirement for alternative medications and dosage forms may be determined by a patient's general practitioner who prescribes the medication or other allied health professionals. For example, a speech pathologist who identifies a swallowing difficulty, a physiotherapist applying ultrasound which interferes with transdermal drug delivery, or an occupational therapist identifying that a patient cannot physically manipulate their current medication packaging. This highlights the importance for other members of the healthcare team to have knowledge and understanding of compounded medications. While the importance of compounding is well established and past studies have demonstrated the benefit of IPL, there is no evidence of such workshops having taken place previously. This study is novel as it investigates students' understanding of the importance of multidisciplinary teams in regards to compounding in a rural and remote setting. It also aimed to increase knowledge and understanding of the role of the pharmacist by other health disciplines. The Mount Isa Centre for Rural and Remote Health is a university department of rural health that facilitates clinical placements for students from all health disciplines, including medicine, pharmacy, dentistry, speech pathology, and more. While students undertake placements in Mount Isa, they participate in a variety of education and training sessions at MICRA, and there was an opportunity to conduct the compounding medications workshop. An on-site compounding laboratory was set up in the Clinical Education Simulation Unit, facilitated by a clinical pharmaceutic specialist and pharmacy academic. Participant recruitment for this study was aimed at healthcare students from a number of disciplines undertaking rural placement at MICRA. Initially, it was hoped to include at least one student from each discipline in the study. However, as participation was voluntary and only available to students on placement at the time, and choosing to take part in the workshop, not all possible health disciplines were included. The workshop involved a compulsory 1-hour introductory lecture on the theory supporting compounding medications, including a patient case, and a 2-hour workshop compounding 3 pharmaceutical products. The workshop led students through the stages of preparing the products, which included a transdermal cream, a topical cream, and a medicated lip balm. These products were chosen as appropriate for the skill level of all participants and for the resources and equipment available in the setting. At the conclusion of the workshop, all participants engaged in a focus group which explored views on the multidisciplinary compounding workshop. especially in rural and remote contexts, including discussion regarding the similarities and differences between urban and rural practice. Analysis of the focus group data indicated that students perceived the workshop to be a useful activity that improved their understanding of compounding medications, the role of the pharmacist, and the contribution of different disciplines. 15 students participated in the study. The median age was 23 years, and 7 health professions were represented by the student sample: medicine, pharmacy, dentistry, speech pathology, physiotherapy, nursing, and Aboriginal public health. Of the 15 participants, 12 were female and 3 were male. All except one student had previously undertaken a rural or remote placement, and all except 3 students originated from a non-metropolitan city. 4 themes emerged from the data: knowledge and understanding, application to practice, interprofessional collaboration, and rural, remote, and Indigenous context. I just have some of the quotes up on the screen at the moment, which you can read. If you want more, I'll talk about that later, sorry. All students agreed that the workshop improved their knowledge and understanding of the concept of compounded medications. Students from disciplines other than pharmacy described the concept of compounding as new and interesting. There was wide acceptance that they would benefit from more education about compounding medications at an undergraduate level. Pharmacy students explained that their prior knowledge was validated and extended with respect to both the nature of the medications prepared and the practice setting in the workshop. Participants described the information learned as useful for their own practice and that there is potential to share their new knowledge with patients. Terms including customised, individualised, and personalised, available options and alternatives were elicited from the focus groups, and these terms reinforced a patient-centred care approach to health. Students acknowledged a relationship between their practice and compounding medications. Some students described a connection through their ability to explain alternative options to patients, and others made direct links to their own practice. There was recognition from participants that although they may not ever use compounding directly, they appreciated having the knowledge and hands-on exposure of the specialty for their own practice and the opportunity to share with patients who may benefit. Furthermore, students realised the potential for compounded medications to provide more suitable alternatives for patients with a variety of health conditions that they have experienced in their practice, including scabies, mites, head lice, worms, stroke, diabetes, dysphagia, and even non-adherence. Participants were emphatic about the value of the interprofessional workshop. They described shared knowledge across disciplines and the importance of collaboration for better patient outcomes. Pharmacy students appreciated the opportunity to share with other disciplines more about the role of pharmacists generally, as well as the more specialised pharmacy services such as compounding. The workshop also provided opportunity for all disciplines to consider interprofessional practice in their own disciplines and how each healthcare professional can learn from others. Students described the workshop as being useful for a range of health professions, including nurses, physiotherapists, medical practitioners, speech pathologists, and occupational therapists. One participant commented that any health discipline can learn from this. Participants described a variety of enablers and barriers to the application of compounding medications in a rural setting. They acknowledged that cost, adequately trained staff, functioning equipment, and access to materials may limit the capacity of a pharmacy to provide a compounding service. In their rural placement experience, pharmacy students described only limited compounding practice. They also described a potential application of compounding medications to Indigenous healthcare. One participant was inspired by the potential of compounding traditional Indigenous bush medicines and Western medications for a more culturally appropriate method of managing health conditions in a rural setting. The findings of this study have demonstrated that students from multiple health disciplines valued the learning opportunity and the hands-on aspect of the compounding workshop. They confirmed an improved knowledge and understanding of this specialised activity and recognised the application to practice, particularly in a rural and remote setting. Students valued the interprofessional design of the workshop and enjoyed a collaborative approach to individualising medicines. The workshop provided opportunity for undergraduate students from multiple disciplines to gain an improved understanding and appreciation of the role of the pharmacist. In particular, students agreed that they had gained new knowledge of both the general role of the pharmacist and specialised practice areas such as compounding pharmaceuticals. Students felt that knowledge gained from the workshop broadened their understanding of patient considerations relating to medication administration and gave them confidence in identifying and referring future patients who may benefit from a compounded product. Students also recognised their individual discipline's contribution to medication management, and dental students who work predominantly in the mouth described a lack of consideration for swallowing difficulties. Similarly, speech pathology students who frequently conduct swallowing assessments had not previously considered the role of the pharmacist in developing dosage forms that are more appropriate for patients with various swallowing impairments such as dysphagia. Physiotherapy students made connections between their work with topical preparations and the concept of medication delivery through the skin. Providing this workshop in a rural and remote setting encourages students to consider enablers and barriers to medication management in an isolated environment. It allows pharmacy students to consider the specialised training, equipment, time and costs associated with compounded pharmaceuticals and the pathway for obtaining compounding products in areas where compounding is impractical. Indigenous health connections were made particularly in regard for the potential of compounded bush medicines and alternative delivery methods to aid adherence for this vulnerable population. Literature has described the importance of interprofessional, collaborative and patient-centred care and is particularly important in rural and remote areas. Effective rural healthcare delivery is increasingly viewed as a team approach rather than a series of individual health professionals' efforts. Conducting this workshop in a rural community allowed participants to reflect on actual rural healthcare practice. It also provided students with a better understanding of holistic rural health service delivery to develop skills in gathering information about services and resources available. The study is unique in that it involves students on rural and remote placements and thus aimed to develop students' understanding of multidisciplinary practice in a rural context. In conclusion, the study adds to evidence that healthcare students believe that IPL activities have the potential to positively impact on their future practice. It also provides evidence that workshops of this nature increase knowledge, awareness and appreciation of the role of healthcare professionals, in this case the pharmacist, as an important part of a multidisciplinary healthcare team. Based on the results of this study, these workshops are an effective method for facilitating interprofessional collaborative practice. Future research may explore further the benefits of engaging students in specialty practices in both rural and urban settings to determine whether the experience, knowledge and understanding gained will impact on future practice. In particular, we wanted to acknowledge the students who generously gave their time to participate in the study while they were on placement. Thank you to the JCU Pharmacy Department for providing the equipment and consumables for the workshop. Thank you for Centre for Rural and Remote Health for their funding and support. And special thanks to Julie Emerson and Gail Weeble for their help organising this project. Thank you.